Good morning, close to good afternoon. Thank you for joining us on this last day of November. Today we'll discuss the COVID situation in P.E.I. and Canada, and of course mention the new variant of concern, the Omicron, and the vaccine rollout. And before discussing these issues, and based on some input I had, because it was my daughter who thought these points are getting lost in the middle of the briefing. There are 3 points I'd like to make, and I think I've made them before, but I'm going to start with them. First, if you are feeling unwell, do not go to work and avoid attending public events or gatherings. If you are sick, the very best thing you can do to protect yourself and others is to stay home, other than to seek healthcare services. Secondly, if you have symptoms of COVID-19, even mild ones, please visit a drop-in testing clinic to be tested, regardless of your vaccine status. Early detection is key to limiting the spread of the virus, so get tested if you have symptoms. Third, if you travel out of the province and are not tested at the point of entry when returning to P.E.I., be sure to visit a testing clinic or complete a rapid antigen screening test, and in addition be tested again at a drop-in testing clinic if you get symptoms, as well as between day 4 and day 8. When children under the age of 12 return home from out-of-province travel, they should be tested at point of entry or by an antigen screening test and have a negative test prior to returning to school. Children under the age of 12 should test 2 more times, on day 4 and again on day 8. Unvaccinated children under the age of 12 years who return from international travel should not attend school, camps, daycare, or activities for 14 days. In other words, follow the travel-related testing and isolation requirements for your specific situation. I think if we all do our part to try to adhere to these 3 points and continue to vaccinate people as much as possible, as a province, we will be more successful in limiting importation of COVID-19 and containing transmission. So globally, when we looked at the numbers again, we've had 5.2 million deaths from COVID-19, and the number of cases and deaths globally have been increasing over the last month. And similar to other countries, in Canada we are seeing more COVID-19 cases, with a 16% increase in the last week. Case counts are up in most provinces. In the Atlantic region, there were 729 new cases in the last week. Today in P.E.I. there is 1 new case of COVID-19 to report. This individual, a contact of a previously reported case, is under 19 years of age and has been self-isolating. Contact tracing is complete. We currently have 29 active cases in P.E.I. and a total of 373 cases since the pandemic began. Beginning on November 17th, a cluster of cases was detected in Prince County. Since that time, cases linked to this cluster have emerged across the province. Currently, there are 28 cases linked to this cluster. Public Health is following approximately 315 close contacts linked to these cases. The last case linked to this cluster was diagnosed on Friday, November 26th. Since mid-November, we have reported 45 cases in P.E.I., including outbreaks in 3 workplaces. None of these workplaces were identified as public exposure sites because they did not provide services to the public. We have been asked about what employees and workplaces can do to prevent transmission of COVID-19. Employees should not go to work or to public events or gatherings of any sort if they are not feeling well. And again, if individuals have symptoms, they should visit a drop-in clinic to be tested. Employers should encourage staff who are not feeling well to stay home and not attend work. This advice applies to individuals regardless of their vaccine status. As I mentioned last week, to the extent possible, employers should do what they can to support their employees who are sick and unable to come to work. Employers should ensure they have basic public health measures in place to protect staff and the public, such as wearing masks, physical barriers where appropriate, physical distancing, hand hygiene supplies, and additional cleaning of frequently touched surfaces. Since last week, there's been a new variant of concern, B.1.1.529, or the Omicron variant, designated by the World Health Organization. Omicron is a concerning variant as it has a high number of mutations, over 50 mutations. Originally detected in South African countries, we now know the Omicron variant has been detected in a number of other countries, including at least 2 provinces in Canada. To date, there are no cases of the Omicron variant here in P.E.I, but all of our positive COVID-19 samples are sent to the National Microbiology Lab in Winnipeg for genetic sequencing, and it takes a few days for these results to come back. Although this variant is new, and I know we'll learn a great deal more in the next couple of weeks, it appears as if this Omicron variant spreads very rapidly. There is early evidence of increased transmissibility and infectivity. It will take time to determine if the current vaccines are effective against the Omicron variant. And it is too early to tell if this variant will replace the Delta as the dominant strain. As of Friday, the federal government imposed enhanced border measures, including additional testing and isolation requirements for all travelers, including Canadian citizens who have been in the Southern Africa region within the last 14 days. The federal government advises Canadians to avoid travel to Southern Africa regions. The situation is evolving. Travel restrictions are changing quickly and may be imposed by countries with little warning. The Public Health Agency of Canada is tracking developments related to the new Omicron variant. Specifically, FAC is evaluating the new variant to determine potential implications related to transmission, clinical presentation, and vaccine efficacy. I am in regular communications with my colleagues across the country and with the Public Health Agency. Information is being gathered and shared with provinces and territories as it becomes available. In P.E.I, we will continue to test at the points of entry and recommend that travelers have at least 1 additional test after arriving in P.E.I between day 4 and 8. Decisions regarding enhanced testing or isolation measures for people traveling to P.E.I from other countries will be made based on the best information available and a risk assessment. There will be an update provided by the end of this week regarding any temporary measures to further protect P.E.I residents from importation and transmission of COVID-19 and all of its variants. We know that vaccination in combination with public health and individual measures will continue to limit the spread of COVID-19 in our province. So I'm going to speak a little bit about vaccine rollout. Last Friday was a great day as we began immunizing P.E.I children aged 5 to 11 against COVID-19 with the Pfizer BioNTech vaccine. This Health Canada approved vaccine has been specifically formulated for children. The pediatric vaccine provides the opportunity for significant added protection for school-aged children against COVID-19. This increased protection extends to families and the entire province. I had the pleasure of attending the first community clinic in Summerside, and it was wonderful to be part of this important milestone in our fight against COVID-19. The clinics are going well. Thank you to Health P.E.I and especially to the public health nurses who have a wealth of experience and expertise vaccinating children in P.E.I. Parents and guardians have a choice to have their children immunized at community clinics across P.E.I or at school-based clinics that will begin in early 2022. And parents and guardians will receive more information from the school in early January. Community clinics are scheduled for Montague, Surrey, O'Leary, Charlottetown, and Summerside. The vaccine booking line and Skip the Waiting Room have been busy booking appointments. We know that 523 children received their first dose of vaccine on Friday and Saturday, and there are 1,350 appointments booked this week, including, I think, 2 of my children this afternoon. Common side effects from the pediatric vaccine include redness at the injection site, fever, sore arm, and fatigue or feeling achy. These normal reactions usually subside in a day or 2. P.E.I. received a shipment of 500 doses of Janssen vaccine, a single-dose viral vector vaccine. This vaccine is available at participating community pharmacies. The Janssen vaccine provides a lower level of protection compared to 2 doses of mRNA vaccine, either the Pfizer or Moderna. For this reason, individuals who choose to have Janssen are recommended to have a booster dose of mRNA vaccine for optimal protection. As of Saturday, November 27th, 94.6% of eligible island residents over the age of 12 have received at least 1 dose of vaccine, and 91% of this population have been fully vaccinated. And reaching 91% of the population being fully vaccinated is very good news. During the last week, 45% of doses administered were 3rd doses, including boosters. So in total, 6,833 3rd dose boosters have been administered. But I would really want to encourage islanders who are eligible for a booster to make arrangements to get their 3rd dose. Getting a booster is important and will boost your immunity and help to protect individuals against severe outcomes from COVID-19. As a reminder, people in the following groups are recommended for a booster, provided it has been 6 months since their 2nd dose. Adults aged 70 and over, adults in or from First Nation, Inuit, and Métis communities, and individuals who received 2 doses of AstraZeneca or 1 dose of Janssen vaccine. Also, healthcare providers, healthcare workers who provide direct patient care who receive their first 2 doses, where the interval between those doses was 28 days or less, are also recommended to receive a booster if it has been at least 6 months since their 2nd dose. Individuals who are eligible to receive a booster or 3rd dose should contact a partner pharmacy via the website to book an appointment, or book online with a public health clinic, or call the vaccine booking line. We've had numerous inquiries from individuals who are not yet eligible to receive a booster regarding when it will be their turn. I do expect the National Advisory Committee on Immunization will be making a recommendation soon regarding boosters. When this recommendation is made, P.E.I. will be ready to administer boosters to everyone who is eligible. And I would point out that at this point in time, 41% of those who are age 80 and above have received their booster, but particularly in these older age groups where it's recommended, I'd encourage individuals to make their appointments to get their boosters. I appreciate that islanders are weary and tired of COVID-19. I can relate to those feelings, and I'm sure all the members of our public health team across the island can do so as well. We all want this pandemic to be over. Unfortunately, the virus does not care if we are tired. COVID continues to find ways to get into P.E.I. and spread, and that's not just in P.E.I., it's in Canada and throughout the world. While we wait for better epidemiological data on the Omicron variant, it's important that we remind ourselves that, as a province, we continue to be in a good position to deal with whatever challenges that COVID-19 presents. We do have a system to test people coming into the province. We have excellent PCR testing capacity. We follow up on individuals who are required to self-isolate. We have a safe, effective, and accessible vaccine for everyone over the age of 5. We have a high rate of full vaccination. We've given booster doses of vaccine to all residents of long-term care and community care. We are giving booster doses to others who are eligible. We have maintained capacity to conduct contact tracing and conduct regular follow-up with cases and close contacts. And to date, we've been able to protect our health system from a surge in demand for acute and critical care related to COVID-19. And although we are not yet out of the woods with this global pandemic, we have many strengths and assets on our side as we enter our 2nd winter with COVID-19. Some people may be wondering about holiday gatherings and are asking about potential impacts of the Omicron variant on their plans. At this point, it is still recommended that festive gatherings be held respecting the current gathering limits. I've said it before and I'll say it again. There is no place I'd rather be living throughout this pandemic than right here in P.E.I. As we continue our journey with this virus while preparing for the holiday season, we will need to continue to draw on our best qualities as Islanders: resilience, caring, understanding, and generosity. And please let us continue to be patient and continue to be kind. So thank you very much, and I'll open it up to some questions. Maybe we'll start with you.
How many recent cases were people going to work sick? There were 3 workplaces impacted, but was it 3 people who had gone to work when they had symptoms? Did they have symptoms at all?
So, hi. So we don't speak about individual situations, but we do, try to put that reminder in. I think I mentioned it a couple of times in the notes that, and previously, it's really important that people don't go to work when they're having symptoms. I think sometimes their symptoms are mild, so that people may assume it's something, just a cold, but we know that there have been people who've traveled and or maybe have been in contact with someone who has traveled, and it's really important that you go and get tested and not go to work if you're symptomatic, or go to personal gatherings or other kinds of gatherings. And I think we've been saying it a long time, but I think it's just worthwhile mentioning, especially when we see this number of cases within the last couple of weeks. It's probably worth mentioning that if we'd had this number of cases this time last year, we would have probably been in a circuit breaker of some kind. But so when we look at the where we're at this time now compared to last year, the rate of vaccination and our ability to protect people because of vaccines is helping us not go into the same kinds of measures as we had last year. And as we go into into December, we're hoping not to have to make any adjustments, but a lot has to do because we know the vaccines are working.
Okay. And when will vaccine passes be required for 5 to 11-year-olds, if ever?
So we have tried to answer that question previously. At this point, NACI does not recommend that proof of vaccine be required in this age group, and P.E.I. is not intending at this point in time to make proof of vaccine or VaxPax requirements for that age group. And we also know that it would be months from now anyway before they would be fully vaccinated. But at this point, that is not the intention.
Okay. Why not?
Well, I think, one, logistically, there's at least a 2-month window between the first dose and second dose. So by the time we get our children vaccinated with both doses, we're likely talking about sometime later in March right, before they would have that opportunity to be fully vaccinated. And we're also following certainly national advice on that and the recommendations of NACI.
Okay. Thank you.
You're welcome. Hi.
Good morning, Dr. Morrison. First question would be on the Omicron variant restrictions. I know you mentioned we're still learning about this and an update can be expected next week, but what are you thinking at this point? What could change?
Well, I think a couple of things. One, P.E.I., we're in a bit of a fortunate position that we're already doing so much testing and doing testing of those folks who are coming in or returning from international travel. And I think we may be not just recommending a second test, but we will be trying to follow up most likely on anyone coming in from internationally and making sure that a second test happens. I am waiting a little bit, and I expect to hear more in the next day or so what the federal government may be doing in terms of border measures, but I anticipate we'll be following the 2 tests for people coming in internationally. And we're also looking at where we can possibly put some measures in place, such as in long-term care. So if you've been traveling internationally, not going to work or visiting a long-term care facility for a period of time when you arrive back in the country until we know you have at least 2 negative tests, for instance. So those are the kinds of discussions where we're trying to, are we doing everything we can to protect Islanders when we don't know everything yet about this variant and how effective our vaccine is against it. So those are parts of the discussion.
Okay. Next question for you would be, how concerned are you about the growing number of breakthrough cases?
Well, I think no vaccine, no medical treatment, for that matter, is 100% effective. And you've certainly heard me say that here before. So some people will get COVID-19 even though they've been vaccinated. And again, we've talked about that. So the reality is that the more people who get vaccinated, then we will see lower overall case counts, hopefully, but a greater proportion of those cases could be breakthrough cases. Now, in P.E.I, we have, of all our cases in this year, 70% of them are not fully vaccinated. So by far the majority of the cases are not fully vaccinated. And of the ones who are fully vaccinated, certainly we haven't had anyone end up in hospital. And I can tell you that when I speak to people who've been diagnosed with COVID-19, Islanders or island residents, they are relieved even if they've been vaccinated, because they know they won't get as sick. They know that they will have minimized the chances that they have spread it to others. And so we can have that kind of conversation. So I also know, and I'm really glad you asked the question, because when we do our contact tracing, we can really tell how well vaccines are working. So if in a room of people, you are all exposed to COVID because someone has COVID, if there are 2 people in the room who are not vaccinated, high chance that they will end up with COVID. But of the other 30 people in the room, they're all vaccinated. Maybe a couple of them might end up, 1 or 2 might end up with COVID-19, very mild symptoms, but none of the others who've had the same exposure because they're vaccinated will get COVID. And so it means that the vaccines are working. We know that the chances are so much greater of ending up in hospital if you're not vaccinated versus vaccinated. And I think one of your colleagues asked me this the other day, and they said, does that mean that if the cluster of cases that we've had recently, if we hadn't had such high vaccination rates, that cluster would be much bigger? And I said, exactly. If we haven't had this, such a high vaccination rate, the number would have been a tremendously higher. So I know I had written some of these down, these notes down. So in Canada, in the 12 to 59 age group, unvaccinated people are 42 times more likely to be hospitalized with COVID-19 compared to those who are fully vaccinated. So it's not 100%. A small percentage of people who are fully vaccinated will get infected. But I think I'm so pleased that we have such a high vaccination rate because I do know it's protecting us from severe illness and death, but it's also protecting the further spread, even if you're exposed to it.
And I'll just ask one more question. You spoke about the high vaccination rate and how without it we would likely be in circuit breaker phase right now. What would it take at this point with our high vaccination rate to end up in a circuit breaker again?
So we do have certain indicators that we follow and look at from our epidemiologist puts those together. And some of it has to do with our healthcare capacity, our public health capacity, where if we are not able to have some sense of where the put our arms around certain outbreaks, if there's widespread community transmission, especially with people who may not be fully vaccinated, there's a number of those that we would be looking at. At this point in time, I really am hopeful that we don't have to do that. But I think we have a lot of things in place to help prevent us from going there again. And I think I said last week we're in a much better position this Christmas or season, a holiday season, than we were this time last year.
Okay, thank you very much.
You're welcome.
Drummond, Radio Canada.
I couldn't hear anyone.
Gabrielle Drummond, Radio Canada.
I think I heard Gabrielle. Gabrielle, are you there?
Heidi, CTV.
Okay. Hi, Heidi.
Hello. Sorry, I had to take myself off mute. That helped. I was wondering when you would know of the positive cases that were sent to the National Microbiology Lab, how long it takes for those to come back in terms of knowing if there's any of the new variants within them.
It usually takes a few days, always less than a week, and sometimes the turnaround is fairly quick. So up until now, all our cases really in the last couple of months have all been the Delta variant. So, but it would take us a few days to know if any of these newer cases would be linked. I do not anticipate that at this stage. The cases, the most recent cases were not related to international travel so much, but we'll have a look. All of them are sent off regardless of the positive cases and their travel history to the National Microbiology Lab.
And just wondering what would change if results came back and there was a new variant within them. What would happen after that?
Well, certainly we do, we put our cases in isolation, and we do, I think, a good job at following up contacts and close contacts. And our close contacts, who are household close contacts, are isolated here for a minimum of 7 days, even if they're vaccinated. So, in terms of changing our case management, those are discussions we've been having nationally as well. As we learn more about this variant, will there be changes in how we manage? At this point in time, I think we would continue doing a lot of what we're doing, isolation, testing of obviously our case in isolation and testing and isolation of close household contacts and testing of even casual contacts at this time.
Unipi, The Guardian.
Hi, Dr. Morrison. Apologies in advance. I might be having a few connection issues. But yeah, I did want to return, I guess, to the breakthrough case discussion. I think I'd sent in a number of questions about breakthrough cases, but haven't been able to get a response. So I'll sort of read them out here. I had asked since June 1st, 2021, how many essentially breakthrough cases PEI had experienced. I picked June 1 because it was the date in which I think the Delta variant obtained a name, and had asked for kind of a breakdown of the numbers of breakthrough cases associated with both the West Prince cluster and the West Royalty outbreak earlier this fall. So I'm wondering if you can provide those numbers.
Hi, Stu. And I think similar to the earlier question, I'm really glad to be able to talk about this. And I think certainly the media have such an important role in getting this message out about the importance of vaccine, and that there are breakthrough cases, but they are certainly the minority of what we're seeing. So we have the numbers in 2021, not since June, but the majority of our cases, Stu, have been since June. So we have 70% of the cases who are not vaccinated, and we have had, we have 132,385 Islanders who've achieved full vaccination status, and so 83 of those, or 0.06%, were diagnosed with COVID-19 fully vaccinated. It's, and so we don't, in order to protect the privacy of individuals and to ensure that estimates meet reliability standards, information on the vaccine status of our cases is updated periodically, so not every time there's a case. When rates are based on a few cases, it becomes really challenging to distinguish random fluctuations from true changes. And I'm sure you can appreciate that, Stu. So that's, and our epidemiologist has worked very hard to make sure that these are updated as appropriate. I don't have the number of cases related to West Royalty, but I think you would certainly appreciate that the West Royalty outbreak was, given the age group impacted, a large portion of them were unvaccinated, and our recent cluster of cases, I don't have them broken down, but we'll speak about the cases overall. And sort of what I said earlier, it is when we go through this, we know that vaccines, like any other medical treatment, are not 100% effective. But when we know how much more frequently people who are unvaccinated end up in hospital with COVID-19 compared to those who are fully vaccinated, it's amazing how many people who are vaccinated and who get exposed to COVID-19 do not get COVID-19. So in our workplace outbreaks we've seen, Stu, in our recent cases, and when we're doing contact tracing, whether they're in a workplace or a team or in another setting, it's if you're unvaccinated, much more likely to get COVID, and if you're vaccinated, you may still be diagnosed with COVID-19 or get mild symptoms, but there are many with the same exposure who are vaccinated who are not getting COVID-19. And I do think that's important for people to understand. And if you do get COVID-19, your chances of getting sick are so much reduced.
Sorry, I was cutting in and out there. All right, so I'll repeat this back to you so I make sure I understand this. What I'm hearing is that, I'd asked for the June 1 numbers, since June 1, cases that are fully vaccinated, partially vaccinated, and unvaccinated. And what I'm hearing is that number just since June 1st is not available.
It's something that we are very consistent, Stu, with the numbers that are published in other provinces, like our neighbors in Nova Scotia, that they publish, and federally, nationally. The numbers that are being released are for since either December of 2020 or January 2021. And so we are doing the same kind of approach here where we're trying to use since 2021, since the vaccine started. So that'll be similar and making some adjustments, of course, as we need to go. And so the majority of our cases have happened since June, Stu. So when we look at the numbers, and I'll see if I can give you the exact numbers as opposed to the percentages here. It's just so that since that time, but we have. And certainly I can follow up with you, but we have the percentages and the numbers who are fully, partially, and unvaccinated. So the percentages I was giving you are, we have 70% of those who are not fully vaccinated have been our cases in 2021.
Hello? I'm cutting out here. Hello? Can you hear me?
Yes, I can hear you.
Sorry about that. You cut out there.
Stu, I mean, I feel like we've tried to answer some of your questions here. And we've talked about the cases here and what an important role you have in making sure the public understands what we've been saying, that although vaccine is not 100% effective, and we do have breakthrough cases that are similar to very much in line with the rest of the country. We've not had hospitalizations related to our breakthrough cases. And we know that those who have been fully vaccinated, their chances of being in hospital are much less.
I have to apologize. I missed a lot of that. I really seem to be having some connection issues.
Yeah. So maybe, Stu, maybe we can just, someone can summarize some of what we've said here, and then we can send it to you. Would that be okay?
Sure, that would be good.
Okay, because I feel like we've said it a couple times here.
Okay. One, I guess, follow on this. I mean, you mentioned the three workplace, I'm not sure if they're referred to as outbreaks or clusters, but I'm just wondering, I mean, a persistent point of debate during this whole pandemic has been policy towards paid sick days. I'm wondering if there has ever been a recommendation from the Chief Public Health Office to, I guess, the Executive Council related to putting in place even temporary fully paid sick days more than the one that is in current labor laws in P.E.I.
Hi, Stu. So I think that questions probably regarding the labor laws is probably best directed elsewhere. So we have been consistent since the beginning in certainly supporting and asking employers to support those who may need to work from home or who need to be tested or need to be in isolation. So we have certainly been clear about that, and I think the rest of the question would be best directed to, as you mentioned, the Executive Council or those more involved with those labor laws.
Okay, thanks.
Okay, thanks.
Hi there. Yeah, the connection is not great, Dr. Morrison. So apologies if we have to repeat a couple times. You're cutting in and out a lot today on the phone line. I had a great question from someone whose granddaughter, they said, turns 12 in January. And she wanted to know whether she should wait to get the adult vaccine or get the pediatric shot now.
Hi, Louise. So the recommendation is quite clear. So that if someone is 11 today, on the day they go to get their vaccine, they would get the pediatric dose. But on when they 2 months later, they when they get their second dose, they would get the dose for the 12 and up, and that is going to give good effectiveness if that happens. And they've looked at that, and we're clear as soon as NACI made that recommendation that that would be the best direction, and so. I mean, it's certainly an individual's choice of when they want to book their appointment, but as the mother of an 11-year-old, I'm not going to delay him getting his first dose of vaccine until he turns 12. I'll give him his first dose as soon as, well, I think hopefully today. He may not be as excited as his parents, but we'll see.
Understood. So basically, don't wait. If you can get a vaccine now, get that. And then I guess on that point, when will the vaccination numbers reflect the fact that we are now, we keep talking about the eligible population, 91% are fully vaccinated. When will we start to reflect eligible population as 5 and up on Prince Edward Island?
So I looked at that, Louise, this morning as of what it could look like on the website. We've been also we're in discussions with how it's going to look nationally in terms of how it's being reported. So we were trying to see if we could line up with how it's being reported both nationally and also provincially. But I think if it's not on the website tomorrow, or hopefully by the end of the week, it will have our also listing how many people are getting their third dose boosters on the website, as well as those who are 5 to 11. At this point in time, I think we'll be listing the percentage, the number of eligible Islanders who are between the age of 5 to 11 and the number of those who are vaccinated in that group. And I think nationally they're also going to be keeping that separate and not just including it with the rest of the population at this point. But you'll definitely see more on the website. It's just really trying to make sure it gets up there in a way that everyone can see it and understand it.
Thank you very much.
You're
Appreciate
welcome.
it.
You're welcome.
Gabrielle Drummond, Radio Canada.
Bonjour, Dr. Morrison. Je suis désolée, j'ai raté mon tour parce que je vous entendais pas bien. Je suis désolée. Donc, ma question pour vous, c'est par rapport au variant Omicron, justement. Vous l'avez dit en anglais, mais j'aimerais l'entendre en français. Alors, quel type de changement de mesures sanitaires on pourrait voir bientôt ici à l'île du Prince-Édouard par rapport aux règles de voyage entre les provinces, les voyageurs internationaux, même pour les foyers de soins de longue durée. Alors, de quelle façon l'arrivée de ces variants-là au Canada, ça va changer les mesures sanitaires dans les prochaines semaines?
Bonjour Gabrielle. Alors, je pense qu'on est en train de apprendre beaucoup à propos de Omicron dans les prochaines quelques semaines. Et puis, mais à ce moment, on va encourager, on fait les tests quand même pour les gens qui arrivent à l'île du Prince-Édouard et les insulaires qui viennent de retourner à l'île du Prince-Édouard. Mais on fait une recommandation qui sont testées une deuxième fois. Et alors, on discute si on doit mais un règlement qui doit être testé une deuxième fois s'il voyage dans une région internationale. Et puis, on discute aussi si on doit limiter s'ils peuvent entrer ou travailler en foyer de longue durée s'ils viennent de retourner à des voyages internationaux. Alors, on va faire une détermination de ces mesures vraiment dans les prochains quelques jours, mais je veux voir aussi qu'est-ce qu'ils vont faire aux frontières canadiennes et on veut qu'on soit vraiment en ligne si c'est possible.
Oui, tout à fait. Une autre chose, c'est que vous avez beaucoup parlé de l'importance de la vaccination pour justement prévenir, pour empêcher la propagation de la COVID-19. Et maintenant, on a ce variant-là. Est-ce que, à la lumière de tout ce qu'on connaît jusqu'à présent de ce variant, et on va en apprendre davantage, est-ce que vous réfléchissez peut-être à rendre la vaccination obligatoire ici à l'île du Prince-Édouard, ou même vous réfléchissez à étendre l'obligation de la 3e dose à d'autres groupes d'âge bientôt?
Alors, peut-être la dernière partie de la question en premier. À ce moment, on attend, et je pense peut-être par la fin de la semaine, on va avoir plus de direction à propos de la 3e dose de vaccin pour peut-être plus de personnes, plus de groupes. Et alors, j'espère qu'on va avoir quelque chose. On en parlait. Mais je pense pas à ce moment de faire obligatoire pour le VaxPass ou pour les gens les plus jeunes à 5 à 11 ans. À ce moment, on pense pas, et puis et on sait qu'on est vraiment content qu'on a tellement de nombre de personnes ici à l'île du Prince-Édouard, les insulaires qui sont déjà vaccinés.
OK. Excellent.
Okay.
Merci beaucoup.
Okay, merci beaucoup. I think that's it. Thank you very much. I apologize if there was some issues with the phone, but for those in the room, I think it was a good day to be in the room, I guess. So, okay. Thank you very much.